I just came here for
Welcome back. It's become something of a trend among celebrity stars like Kim K and Brandi Glanville. They've undergone the procedure and come out singing its praises. It's called vaginal rejuvenation or vaginal tightening, which is a little better description of what the procedure is all about. If you haven't heard of it before, fair warning, we're about to get very personal for the next few minutes. And joining us with the details on what it is, who it's for, and the benefits, we welcome Dr. Kanika Shalin, the director and founder of the Center for Modern Aesthetic Medicine, to the show. Welcome.
Welcome to the chat,
Very
Doc.
exciting.
I love talking
We
about
want to
this.
dive
Thank
right
you.
in.
Okay, let's do it. Let's
told
do
all
it.
of them they just need
Well,
to
hold
be
on,
I'm not gonna
audience.
take that from
Hold
Kat,
on,
though.
let's not dive in yet. We're gonna ease our way into this
All right.
conversation. I think we gotta ease in a little
No.
bit. I know you're chopping at the bit. Hold on, because we gotta know
Hold on,
the Center
hold
for.
on.
I know.
Breathe.
I know.
I got it. I got this. Okay.
See, women
like
don't know
having
about it,
children
but
all over
everybody's
again.
interested.
Yeah.
Everybody's
Yes.
interested.
Okay,
Yes.
so
Yeah.
the Center for Modern Aesthetic Medicine, what is it and what kind of services do you provide?
Well, we're a specialty aesthetic center for laser medicine, radio frequency, ultrasound devices. Basically, though, what we do is help people feel their best.
I
Okay.
think, okay, so would you like to
So
take it
now-
from here?
The woman with 5 kids says, amen, help
She's
your
like,
sister
oh.
out, you know? I'm listening to all these stars that have gone through the procedure. I'm like, what, you had one kid? No. Okay, 911 for those of us who have multiples here. And I'm glad to know there's an answer. Let it talk to us.
And that's the cool thing is there is an answer, and we didn't think there was before. And when this whole thing came out, I thought, oh, this is just another thing we have to deal with. Are you kidding me?
Yes.
We thought that this was all kind of aesthetic, and it's not. It is life-changing because what it does is it remodels your tissue, just like it remodels tissue in
Wait,
your face.
remodel? Oh, wow. You want to get a remodeling job?
We're gonna
That's
remodel the
awesome.
tissue. It
Wow.
creates collagen, right? So helps with tightening, helps with stress incontinence. So if you're going to the comedy show and you
Yeah,
tinkle and you
yeah,
laugh,
yeah.
it helps with that.
There you
I
go.
didn't even think about that.
Lots of different things. And then symptoms of menopause. I mean, we say, 60 is the new 40, right? And it's really true. People are active
Is it really?
now. Absolutely.
Okay.
Everybody's out in the gym, everybody's active, and that means active in all parts of life. And
Okay. So because I want to know, and I'm sure our viewers want to know as well, what is actually involved in this
Procedure.
coochie tightening?
It is a procedure,
say it.
and it's really, it's surprisingly simple. It's done with a CO2 laser. Core Intima is the laser.
Okay.
It doesn't hurt because we don't have.
It doesn't hurt.
It
Oh, that's
doesn't
good
hurt.
to know.
It doesn't
Yes.
hurt. It's comfortable, and it takes about 5 minutes.
That's it.
What?
That's it.
So do you numb it up?
We numb on the outside. On the inside, you don't need to numb because there aren't a lot of nerves there, so you
Okay.
don't feel it on the inside.
Okay.
We do numb on the outside with just a little bit of cream, and
Not even a
that's
shot.
So is
it.
this
Not
something
even a
that we have
shot.
to go back and get every 6 months, every 90 days, or is it one time and that's
We
it?
do 2 to 3 procedures once a month, and then we're really surprised that the results are lasting about a year or so.
Wow,
so
that's
it's
awesome.
it's a new technology. We've been involved in the research of it from the ground, but we're finding that it's lasting. It's lasting.
Well,
a good
because
amount
I
of
mean,
time.
like what you're saying, I know, like my generation, one of the reasons why you stay so active is for that purpose, to keep everything tighter everywhere,
Right,
and just keep your body strong and healthy everywhere. And as you get older, you're like, okay, you're exactly right. They've got all these solutions for everything and everywhere. It is so awesome to know that 60 can be 40. You know,
60
that's
can
all.
be
So you
40.
say that it lasts about a year. Is this something you have to go back and like get every year or so? If you weren't having children, do you need to keep up?
If you're
with the
not
procedure?
right, so if you're not having symptoms, you don't need to retouch. But it's probably a good idea at about a year to do just one simple, quick session, not the whole 3. If you have more severe symptoms, like a lot of really significant stress incontinence, you might need a little bit more. But in general, we're finding that once a year is good.
So who is actually qualified, or who should seek to get something like
Yeah,
this?
here we go. That's a great
Well,
question.
I think that is a great question. I think it should be somebody that really understands lasers and understands medicine and understands how to work in that area of the body. So you need to know all of those things.
What are the symptoms of a person that should receive the technique?
So somebody who's had multiple childbirths and feels loose, somebody who's having stress urinary incontinence symptoms like tinkling when you're coughing or laughing or exercising. And then the most important is menopausal symptoms, so dryness, pain with sex, lack of lubrication, multiple infections. All of that stuff is improved with this procedure because that tissue just is really responsive. Think about it, when you bite the inside of your mouth, how quickly does it heal?
Oh yeah.
Oh,
Oh
real
yeah.
fast.
Well,
Oh, yeah.
it's
Oh,
very
yeah.
similar type of skin.
Okay.
So,
okay.
yeah.
Is there a cutoff age for this?
We have patients in their 80s.
Wow.
Really? Good for them.
Yeah.
I mean, everybody needs
It's pretty
love.
exciting. Yeah.
I mean, when you hear
That's
that it's
awesome.
not really invasive and there's no pain and it takes 5 minutes, I mean, yeah, you probably have.
Sign me up, right?
Right,
Yes,
exactly. It's
yes.
like, why not?
You do need a vaginal exam. You need to have somebody who understands how to perform that, what they're looking for. You know, it is a
that
medical
something
procedure.
that you do?
So we
That-
do it. Yeah.
So for CMA specifically, how do you and this process differ from competitors who also offer the same process?
Well, I like to think of them as colleagues, and so we definitely have a lot of great colleagues all over town. I think what's different about us is that we teach the procedure to people
Oh, nice.
all over the world. They come to the center to learn,
nice.
and I'm lucky that I get to work with experts from all over the world to really kind of advance the protocols and advance the devices. So I think that's kind of how we're a little bit different.
Yeah, how much has it changed from when this was kind of introduced into the medical field to where it is now and how quick and easy and non-invasive it is?
Well, it's definitely gotten faster. We're getting better results that last longer, I think. I mean, it's still very new. It's a generally new procedure. 3-4 years is when people really started to work with it, you know, but that's how we're seeing things change.
Are there any dangers or downsides to this procedure?
We're really finding very few negative side effects. So as long as you choose the patient correctly, make sure you're doing it for a specific indication that you know you need to do it for, you're going to get results.
And the recovery period after this is?
You can have some swelling for a day or so, a little bit of itching for a few days, but apart from that, it's not very significant.
So what are the kind of reasons that would make you turn down a potential candidate?
Well, if you're talking about incontinence, and it's not stress incontinence, it's a different kind of incontinence, or it's very severe, those people may be better served by surgery or some other types of procedures, you know. If you have, you know, the other types of issues like very, very severe atrophy, which means really, really, really bad dryness, maybe not the best candidate. But, you know, really, it's for those kinds of symptoms, this is an excellent procedure.
So after I have the procedure, I have a few days to heal up, the itching's over, the swelling is gone. Will I see or experience immediate results, or does it take a couple of days to actually get my
Months or
groove
what?
back?
Yeah, absolutely. I mean, your body has to make collagen, so it does take several weeks to see results.
Okay.
But some people notice some results fairly immediately because the swelling from the procedure is enough to make some changes in the way that you urinate. So you have some improvement immediately. And then you have continued improvement as your body replaces that swelling with collagen.
Wow.
So it's pretty quick. And in terms of downtime, I mean, people go right back to work. The second time people come in, first time everybody's nervous. The second time they're texting, they're on the phone.
Oh my gosh, really?
That is nice and comfortable.
We've had girlfriends come in together to do
Oh,
it.
wow.
You know?
So funny.
Really?
It's a party in
It's
here.
a spa day, basically. This is so
Home
great
improvement.
information.
But not to belittle the procedure. It's definitely a medical procedure, and it does some really important things to people's lives. So it's just really cool.
Well, thank
Yeah,
you,
that's
Dr.
really
Sean, for this
encouraging.
information. This
Yes.
is opened up Angie's entire world right now. She's blown away.
All my friends.
All right, well, if you would like more information, you can visit cmamedicine.com, or to schedule a consultation, call 904-772-5828. And after the break, we still got some more. You know we do. For those of you getting serious about sculpting your body, we're sharing details on a new program that may finally help.
Is your body storing fat more easily?